Call me up and I'll be on my way.
Hello everyone, and welcome to the Health GoLive webinar series. Today's episode is brought to you by our friends at Fitbit. Just a few housekeeping items to go over. We would like to remind everyone that the Q&A feature will be available, so feel free to send in those questions for the panelists throughout the discussion. Please join us after the webinar for a relaxing yoga and meditation session. And with that, I will throw it over to our moderator who joins us from Fierce Healthcare, Heather Landy.
Welcome, and thank you for joining this virtual event. I'm Heather Landy, Senior Editor with Fierce Healthcare, and I am very excited to introduce our panelists today. We have Dr. John Moore, Medical Director at Fitbit Health Solutions, Dr. Jennifer Radin, Senior Staff Scientist at Scripps Research Translational Institute, and Dr. Tejaswini Mishra, Research Scientist at Stanford University School of Medicine. And Dr. Radin, why don't you get us started with some introductions, and followed by Dr. Mishra and then Dr. Moore.
Hi, good morning, everyone. So I'm an epidemiologist at Scripps Research with the digital medicine team, and my research focus is on combining digital medicine and infectious disease research. And I did an exciting study this past January where we looked at 200,000 Fitbit users, and we found that when you identify weeks where individuals have an elevated resting heart rate and sleep compared to their norm, this could improve detecting influenza-like illness at the population level. So this kind of inspired our current Detect study, which is aimed to identify viral illnesses at both the individual and population level through a research app. And I'll happy to talk more about it soon.
Great. And Dr. Mishra. I think you're on mute.
I think I was muted. Hi, everyone. My name is Tejaswini Mishra. I'm a research scientist at Stanford Genetics working with Dr. Snyder. And my research interests lie in longitudinal monitoring, profiling, and tracking to detect disease and predict kind of the prognosis of illness. And so I've looked at that in diabetes, in space biology, and now with COVID-19 to try to detect infectious diseases. Our lab has a few years ago looked at using wearables devices to try to detect infectious disease. And so this, our current research on COVID is sort of a natural extension of that. So excited to be here.
Great, and Dr. Moore.
Hi, I'm John Moore. I'm the medical director at Fitbit. My background is as a biomedical engineer and a medical doctor, and my focus has been on the combination of technology with learning science and health psychology research in order to figure out how to empower people to make changes in their health informed by data. At Fitbit, a lot of you know us for steps tracking and sleep tracking, but at Fitbit, we're going well beyond that to really help people to collect data about their activity, their nutrition, their sleep, and their mindfulness and stress management, and pull that all together to help them inform early when they might have diseases, to help them be inspired to take action to manage those diseases or to generally optimize their health when they don't have disease. And so hopefully a lot of that will come out in our discussion here as working with Scripps and Stanford around disease detection around COVID has been part of what we're pursuing as well.
Great, so really excited to have this discussion and to hear all your insights. So let's talk about the role wearables play in advancing medical research. How are wearables benefiting research, and what conditions or illnesses are being researched? Dr. Radin, you wanna kick that off?
Yeah, so as I mentioned, when we started, our group has analyzed a data set of 200,000 Fitbit users. And what we found is every person really has a unique resting heart rate that is specific to them. So your resting heart rate might actually be very different from mine. And wearables enable us to better characterize each individual and better know what their typical norm is over time. And when we know that, we're able to identify changes that may indicate someone's health is changing. So when you get sick and come down with a viral illness, your resting heart rate typically increases. You may be in bed, less active than you typically are, and your sleep might also change. So again, wearables really enable us to better understand what's normal for each person, and each person's normal varies over time and is also different from other people. And this can, again, help us identify viral illnesses and also other impacts on someone's health.
Right. And Dr. Mishra, can you share your thoughts on that?
Yeah, I mean, really to second what Jennifer just said, every person has their own individualized kind of baseline of what these digital vital signs, let's call them the heart rate, your skin temperature, and then everyone has sort of their own sleep patterns. And so the real, what we've been doing with wearables technology and research is to get these data for every person and to try to build a personalized, individualized baseline for them. And then see what changes, and that might correlate with them getting sick. And so you can imagine this could have, we've already used it, again, as Jennifer pointed out, to detect viral infections. And in our case, one of the ones we found was actually not a viral infection, also Lyme disease, that we've published a couple of years ago. And then there's also the potential for tracking sleep and other illnesses, and we can talk about that a little bit as we go through.
Okay, and Dr. Moore, how is Fitbit, what role is Fitbit playing in all of this research?
Yeah, we play a couple of different roles. So one is our devices and our services have been used now in about 1,000 different research studies that have been published. And in many of those cases, we support researchers by offering devices at discount or services at a discount to fuel that research work. Some of that research is in areas like detecting depression and detecting burnout in physicians, comparing people's weight loss and activity in different groups of people that have had cancer and finding that actually the level of activity and level of weight loss that people achieve actually affects cancer recurrence. So it's not just areas like diabetes management and high blood pressure and disease detection, but the scope of research out there with wearables is quite broad. Some of it is monitoring, like we're talking about here, where we're monitoring for acute illnesses, but some of it is also behavior change interventions. So for example, there's a lot of research going on in pre-surgical and post-surgical care where they're giving interventions to orthopedic surgery patients and seeing afterwards if that intervention leads to faster recovery. So really a wide range of research that's going on where we're more passively involved. And then there's areas of research where we're much more deeply involved, where we are, for example, when we're working with Stanford and Scripps and we're sharing ideas, and then we have our own R&D team internally as well, where we develop all of our latest sensor innovations and study other associations between people's health behaviors and outcomes as well.
All right. Yeah, that's really interesting. Now, Dr. Radin, how are the results of the Scripps wearable study helping to drive solutions for COVID-19 and other illnesses?
Yeah, so our past study that we published in January, we found that when you aggregate this wearable data and you look at a population level, that we could identify weeks where individuals had kind of this abnormal wearable data compared to their individual norm, and that this was predictive of influenza-like illness at the state level. And so this is really exciting because current traditional surveillance is often delayed by 1 to 3 weeks. So wearables really have the benefit of being a lot faster, and we can potentially speed up that process of identifying geographic hotspots of viral illness and be able to act a lot faster and respond faster. And so this really inspired us to launch our Detect study, where participants can go through an e-consent, share their wearable data, and self-report symptoms and lab results, so that we can kind of take this to the next step and prospectively see if we identify changes in users' wearable data that may be associated with a viral illness. And this is really exciting for public health because, as you know, currently there's such a lack of testing availability across the United States. And also there's pre-symptomatic and asymptomatic cases. So there's great potential that wearables can help kind of fill in this gap and potentially identify people who may be coming down with a viral illness who should be prioritized for testing, or who should stay home until they better understand what's going on with their health. And it also, again, has the ability to supplement traditional surveillance and enable us to respond faster to local outbreaks before they have the opportunity to spread.
And, do you know, off the top of your head, do you know how many people have enrolled in the Detect study, and are you aiming for a certain number of participants?
Yeah, so we currently have over 35,000. Anyone in the US is able to join our research study, and we're device agnostic. So any wearable device, we can pull in that data. We're hoping to grow it to hundreds of thousands, which will enable us to both better look at the individual changes. So there may be differences by, say, age group or comorbidities, that certain groups may have different kind of, on average, changes in their data when they get sick. So the more people we have, the better we'll be able to look at those differences. And also, one of our goals is kind of to create this viral illness platform where we can, not only for COVID, but for future viral illness outbreaks such as seasonal flu, we'll be able to identify, again, regions that are experiencing high viral illness activity. So this should help improve public health timeliness. Okay,
really interesting. And Dr. Mishra, based on Stanford's research, what are some ways that wearable technologies can be used for real-time monitoring and disease detection?
Yeah, great question. We come at this from a history of, again, as I said before, doing a lot of personalized tracking and so our idea was, if you study a person long enough, you can start to then identify what their healthy baseline looks like and what deviations from that baseline look like. And so we started off with trying to put wearables devices on people. This was a few years ago, and trying to see if we could predict illness. And lo and behold, yes, like we were able to pick up Lyme disease in one individual and viral infections in a couple of other individuals. And we were able to also correlate that with levels of CRP, C-reactive protein, which is a marker of inflammation, showing that, yes, these people were probably sick. And in some cases, I think we were picking up even subclinical sort of borderline pathology as well. And so we sort of, when COVID hit, I just sort of was like, we got to do something, and we can use wearables to try to predict COVID-19. And so we launched this study really after the shutdown started. And so it's been a few months, and we've enrolled about 6,000 people. And what we're doing is, again, as Jennifer said, we're also device agnostic. So we enrolled all these people. We set up a sort of database and system. We developed 2 algorithms to try to detect COVID-19 from the heart rate and steps and sleep data. And so we're able to, the goal of all of this is to try to catch COVID-19 before symptoms hit. And that's because, as you know, most people are infectious in the pre-symptomatic, and there's even asymptomatic transmission occurring. So the idea would be, can we catch people before they start getting symptoms, and can your watch maybe send you an alarm or something and say, hey, your heart rate is getting elevated, maybe you're getting sick, and maybe you should isolate and stay home. And so that was really kind of our big driving goal. And we're able to catch in most of the cases at or before symptom onset. So we try to get the symptom dates from people and the diagnosis dates. And we've really our median time of detection has been 4 days. So we're able to detect onset of COVID-19. So, sorry about that. 4 days before people start getting symptoms. And then the goal would be to take this and expand this, enroll, again, hundreds of thousands more people, and to try to build a platform where we can tell people in real time. So we have two algorithms. One is a offline algorithm where we look at retrospective data, and the other is kind of online where we're looking real time at the data that's coming in and then building predictions based on that. And so the goal would be then to build an alarming system where we look at your data and we maybe give you like a yellow warning, like a caution, maybe you're getting sick. And then if the alarm continues to persist, if their heart rate continues to stay elevated for the next several hours, then say, hey, this is like a kind of a red alert, kind of critical warning. You really should stay home until you get tested, or until you find out more. And then to validate all of this research that we're doing with swab testing. And I think the future of this would potentially be trying to augment, as again, Jennifer was pointing out, like employee-based testing systems, where you can imagine as employee workforces return, they could have swab testing, but that could be augmented with this type of wearables-based prediction, so that people could be asked to isolate already, even if they're not showing any symptoms. And then, maybe community public health, like if you're trying to identify clusters of outbreaks or hotspots, this could be a really good way to try to track that.
I'm really interested. And just as a quick follow-up for both you and Dr. Radin, when it comes to this research and at the individual level, do the individuals involved get any insights back in terms of the insights that you're gaining from their data? Are those insights shared with the participants?
I can go ahead, Jennifer.
That's definitely something that we're planning to build into our research app. So currently we show kind of what their resting heart rate is every day over time. But we do, as Dr. Mishra said, want to kind of give this feedback, potentially like your resting heart rate's elevated, you're less active right now, is something going on with your health? Again, this is still in the research phase, so we also want to balance, not scaring people that I have a little blip in my resting heart rate, something serious is happening. So we're still learning from this data, but we're hopeful that will help inform that something's going on with your health and that potentially you should take a closer look or potentially self-isolate.
Yeah, I have the same answer. The same answer. I mean, I think we want to avoid potentially scaring people, and like, especially when hospitals have a huge burden, to send them to the hospital. Hey, my watch told me so and so, and like, I want to get tested. You definitely want to avoid that. One of the things we want to build in though is, I mean, your heart rate could get elevated for so many reasons. Stress, travel, movie, menstrual cycle. And so some of these things will keep your heart rate elevated. Exercise, the big one that I forgot. And some of these things will keep your heart rate elevated for a while, and some will result in your heart rate coming down after that activity is over. And one of the things we want to build in is sort of this interactive system where the participants, if we have an alarm coming up, let's say a yellow level alarm, low level, that the participants can then tell us, hey, no, actually I was exercising, so no need to worry, or nothing to worry about. So yes, we are building that into our sort of second phase, but we don't have this feedback system built up yet.
Okay, great.
So that's exactly where we're headed, actually.
Okay. There's, as you both mentioned, there's now focus on using wearables as part of COVID-19 research, which is really exciting, and the potential for identifying outbreaks. Now, Dr. Moore, how is Fitbit involved in these efforts? I mean, as you mentioned, Fitbit has for a long time has been synonymous with, tracking steps and activity. So, what is it about the Fitbit devices that it's been useful in this kind of research?
Yeah, I think we've been committed for quite a while now to be much beyond steps, right? And some of that has been in getting into the chronic disease space and supporting people on that front, but also in this space of acute illness, leveraging our data to help give people early warning signs. And this collaboration between Scripps and Stanford and Fitbit has been one where we've been sharing ideas, right? This is a pandemic of unseen proportion that is having huge impact on the world. So what we're trying to do is share as much as possible with each other to drive things forward. And one of the things that we decided to do in parallel with the prospective studies that Dr. Mishra and Dr. Radin mentioned, which has a lot of potential, right? Prospective meaning they're collecting day by day with each individual, which is a big strength of their studies. Our core strength was our large user base. So we did a retrospective study where we sent out a message to our users and we said, hey, can you help the cause? Can you, if you've had any experiences with COVID, either you have COVID or you've been tested for it or you thought you might have it, share your data with us. Let us know when you had symptoms, what kind of symptoms you had. Let us know what kind of test you had, what the result was. And so we were able to collect a large database of users, over 100,000 now. And that's the main value that we're bringing to the table. We don't have the prospective piece at this point, but we have a large retrospective database, which has allowed us to build an algorithm as well. And then all of us have been sharing ideas. Well, what's working? What data points are providing more value, and trying to spur together all of our research, spur it forward so that we can make future advances. And from there, we're trying to figure out other ways with appropriate user consent of collaborating together and sharing data. So going forward, we're hoping to find more and more ways to propel these efforts forward, because to the points made by Dr. Rishna and Dr. Mishra and Dr. Radin, this early detection period is something that there aren't other solutions for. If you wait until symptoms or you wait until fever, it's too late. And we know many people don't develop symptoms, and even more people don't develop fever. The testing, PCR testing, antigen testing, antibody testing, none of them solve this pre-symptomatic period. Even nasopharyngeal swab PCR testing, what we know is that sensitivity prior to the development of symptoms is very low, potentially as low as 0 to 5% on day 0 of infection, which is several days prior to symptoms forming. So if we can figure out a way to give people an early warning sign, to take responsible action and self-isolate, or to allow organizations to develop testing methodologies that can work for our population and be cost effective, then hopefully together as a team, we can have a really compelling impact on this pandemic.
Right, and Dr. Mishra and Dr. Radin, you kind of both already touched on this, but so what are some of the early research showing in terms of using wearables data for detect COVID-19, and what are the implications for using wearables for future outbreaks? Dr. Radin, do you want to take that first?
Yeah, so our initial preliminary research is kind of based off of a similar study that there was a research app that collected symptom data only from a large population, and they found that certain symptoms such as loss of smell and taste were very predictive of someone having COVID versus another viral illness. So what we found is when you add wearable data to those symptom data, that you can significantly improve your predictive ability of whether someone has COVID versus doesn't have COVID. And so again, wearable data has the ability to potentially improve our ability to identify who in the population is COVID positive versus COVID negative. Again, who should potentially stay home and get tested until they know really what they have.
Okay, great. And Dr. Mishra, same question, what is this research showing, and what are the implications for how this can be used for future outbreaks?
Yeah, so we really focused on, which is right from the outset, can we detect COVID-19 or not using wearables data? And can we detect it? How early can we detect it in the advance of symptoms? And so what we're able to see is that we can definitely detect COVID-19 if you just take the cool thing about wearables data is someone has been wearing a watch, even if you enrolled them into your study in March or April, you can still get data all the way back from, July or whatever last year, however long they were wearing it. And so we take all of this data, again, as I said, build their baseline and try to find, can we see an elevation in heart rate that just looks really, out of place, that just is really, really high? Can we identify these anomalous sort of periods of elevated heart rate? And does that track with their COVID-19 infection? And how early does it show up compared to their COVID-19 self-reported COVID-19 infection? And so we to find that, again, as I said earlier, it's enough about 4 days early, although in some cases it can be about even 10 days early before the symptoms that we're able to catch it. And then the other thing we wanted to see is, are we able to predict it in real time? And what happens, and for that we built this online detection algorithm where we're able to see the alarms sort of build up, and we have a statistic called the Q sum, the cumulative sum. And so as your heart rate keeps getting elevated, the statistic keeps rising. And so then you go from like a yellow alert to a red warning, essentially. The other thing we wanted to kind of think about is, well, if you're alarming people, what happens if someone is, because this is based on your healthy baseline and deviations from your baseline. And so you can imagine in healthy people also, you might start to see some alarms popping up, because even a healthy person will sometimes have an elevated heart rate. And so now we're also looking at, well, how often are we telling healthy people, hey, there's something going on with your heart rate? And the other thing we're trying to look at is what happens for infections like the flu, because we're coming into flu season very soon. And are we able to, for instance, distinguish between COVID-19 and flu, which I think the answer is going to be no, but it is important to isolate regardless of whether it's flu or COVID-19. And so we hope that the application or the sort of the implication of this is that this will end up being utilized as sort of a passive sort of self-monitoring, where people are actively engaged kind of in their own health. They're wearing these watches and using them and utilizing these warnings to then self-isolate and stay at home, basically.
Okay, really interesting. And just one quick follow-up to that. In terms of the elevated heart rate, how elevated does the heart rate have to be to indicate illness, or is it more about how each individual, how far off baseline it is? That's
a good question. So we, yes, people have very different elevations of heart rate. So the median across all of the people we looked at that had COVID was about 7 beats per minute, but there was someone whose heart rate was elevated as high as 60 beats per minute. There were people who were a little bit lower than 7 beats per minute. And the interesting thing is, if you compare that to other illnesses, I think we had a small number of I think about 15 other illnesses. There, the heart rate was elevated up to maybe 4 beats per minute. And so that's potentially a way of distinguishing between COVID versus other illnesses. But we still need to validate that and confirm that. It's very variable across people.
I would agree with that. We still are learning kind of what is a typical heart rate response, and it may vary based on the individual's characteristics, say their age group or potentially how severe their COVID infection was. There's many factors that could potentially impact that.
Okay.
Medication, menstrual cycle, all of that. Yeah.
Right. Yeah. Got it. So let's talk about the role, now that you have this research and it's obvious that, wearables can be useful in detecting COVID-19, what role could wearable technologies and wearables data play in the reopening strategy in the US? And, how can it be useful for employers? Dr. Moore, do you want to take that first?
Sure, absolutely. I think that the great thing that we're seeing here is all 3 of our studies have shown that wearables data can predict COVID prior to symptom onset. So that's a great find. We all talked about how that has the potential to help develop better testing strategies and help people self-isolate more responsibly in that potentially most infectious period. And so then what you can do is, instead of needing to test everybody every week, which could be prohibitively expensive and operationally incredibly complex, there are some organizations out there that are doing it, but not everybody can afford to do that. Instead, you have the potential to put in place a monitoring strategy that leverages the wearables in order to more reflexively test people. So that it's not that the wearables would be used on their own as a gold standard. Instead, it would be used in combination with what is recommended by the CDC and other public health authorities. So you still do symptom screening, still do temperature screening of some sort. Likely doing it virtual and remote is ideal because you're not bringing people to a place and risking them while they're in transit, but you can do all this symptom screening and temperature screening from the comfort of their home where they're safe. Still ask them about contact with people who have had COVID and still have a testing strategy. But the wearables, what it allows you to do is a couple of things. One, test more intelligently because you have this extra information. You could reflexively test people, and then when they test positive, then have them isolate. But if they don't, then you have dramatically decreased your number of tests because you've used this extra filter. The other thing we think it would do is also help heighten awareness, because although detecting prior to symptom onset is important, detecting on the day of or the day after symptom onset is probably just as important. So think about it. Someone starts developing symptoms. They say, "Oh, I think maybe I have a cough," or "I think maybe I'm a little short of breath, but you know, am I just thinking about it too much because it's pervasive around me? Am I really overthinking it? Or is it really something true?" And that's a really hard thing to decide. People don't want to think about having COVID, right? It's a scary prospect. A lot of people want to be at work, right? But they also want to keep their colleagues safe. So I think what we can do is not just do the early detection, but also inspire people into action in the early days of illness, where they otherwise might be a little bit, might not be cautious enough, or they might be just not sure of what to do. I think we can inspire them into action. So that what that means for an employer now is you can put in place a virtual solution to monitor symptoms, monitor exposures, monitor for pre-symptomatic biometric changes, and then put in place a testing strategy that goes with that, and use the devices not just as monitoring, right? We've been talking a lot about monitoring. These devices have a lot of potential to nudge people into action as well. So you can educate people, you can get information to them from them about how they're feeling, and you can help promote action in individuals by interacting right on their wrist. So that whole combination suite of things we think can really help make this easier to operationalize for employers, more cost effective, and for the individuals on the end of it, provide a greater experience.
Great. And Dr. Radin, what is your perspective on how wearables could be used as part of the reopening strategy?
Yeah, as John said, right now, screening for COVID typically relies on the temperature screening and symptom screening, but we know from prior research that only 30 to 40% of people who actually go to a hospital and are admitted to a hospital have a fever at the time of admission. So this fever screening is missing quite a few people. And not everyone develops the fever. So looking at wearables and again, getting a better baseline on each individual, we can potentially identify more subtle changes in a user's data that may indicate something is happening to their health. And again, they should stay home or receive testing for that. The other great thing is if you roll this solution out into like a school or an employer, you could potentially identify clusters as well. So there's still the potential of kind of your resting heart rate could go up for other non-viral illness reasons. But if you see a group of people all kind of experiencing this resting heart rate change at the same time, then that is a stronger indication that you have something going on in a particular population, and it requires additional investigation.
Dr. Mishra, what are your thoughts on how wearables could be used as part of reopening?
I think Dr. Radin and Dr. Moore covered most of it. Yeah. I mean, yes, absolutely. You want employers to be using it to, I really want to emphasize the point, to augment other strategies, as Dr. Moore pointed out, not to replace other traditional sort of types of testing, or not to do away with contact tracing, but really to implement all of these together. As he pointed out, again, to try to sort of influence people's behavior. And you can, people have talked a lot about how data from wearables devices can influence behavior, and strategies for doing that, gamification or other ways of doing that. So I think there's a huge place for wearables in reopening. But yeah, I think these guys covered most of it.
Okay. So let's talk about, where do we go from here? I have a device on my wrist. Mm-hmm. So, in the future, could I get an alert on my Fitbit? Oops, I just said what I had. Could I get an alert with like a yellow alert, as Dr. Mishra said, saying, you're at risk of COVID, you need to stay home and get tested. How does this medical research pave the way for how wearable technologies can be used in healthcare moving forward? Dr. Mishra, do you want to take that first?
Could you explain that a bit more, the question?
Sorry, so, with all this medical research about how wearables can help detect illness, where do we go from here? How could it be used? How does this pave the way for how wearables could be used in healthcare moving forward?
How do we sort of translate it into using it in healthcare settings? So that's, one of the things to think about is that these are not medical devices yet. So they're consumer devices. And so that's one step forward. We need to definitely validate all of the things that we're doing with testing to show that, yes, our algorithms are indeed catching COVID-19 and kind of validate these algorithms. The way I imagine this being used in healthcare is, again, sort of how other emerging technologies are currently being used in healthcare, kind of augmenting what physicians are currently doing. But the real kind of future is we're kind of in a world where digital health tracking is already here, and we're moving towards a world where everyone will have these devices. Right now, people don't have them, but they will. And so I imagine that healthcare is going to be really different in the future, where you might have, for instance, this device on your wrist capturing data about you all the time. And normally you might end up going to the doctor when you feel sick in a sort of a more traditional healthcare system, and you go get checked out if you feel something, if you have symptoms. Whereas here, a very different system of maybe your device telling you, hey, maybe you should contact your doctor, or maybe perhaps the information goes from the device also to the person's physician, and the physician calls in and says, hey, your device is telling me something's going on, maybe you need to come in. We also need to obviously think about how often we're sending people to the physician and not creating kind of bloat in the healthcare system. But yeah, I do think wearables devices are going to transform the way we do healthcare, and they're going to end up kind of being an everyday feature of healthcare. And we have to think about how to incorporate that into the way we care for patients, and the way we even manage patients, the way we treat people, the way the frequency with which physician contacts a patient, all of that.
Right, great. And Dr. Moore, what are your thoughts on where do we go from here, and the potential for wearables in research and in healthcare?
Yeah, I think this helps pave the way a lot for monitoring strategies. To Dr. Mishra's point, these are going to be regulated, but that is already being tackled by lots of wearables companies. There are studies for atrial fibrillation detection. There are studies for sleep apnea detection. So not just acute illnesses like flu-like illness and COVID, but also chronic conditions. There's great research being done, and the applicability for detection of depression, diabetes, hypertension. All of these give us an early head start in order to tackle conditions further upstream where we're more likely to make a difference in outcomes. So that's one way that this paves the way. I think this is going to really open people's eyes and really push forward new paths in order to get those kind of solutions out there to monitor and upstream help the early detection of these conditions. And as I mentioned, it's not just going to be about sharing that data with the clinical establishment to help them diagnose and treat. That's going to be an important part, but they're also going to be incredibly important in helping people to be inspired into action, because in the end, the most important thing that you can do for many conditions is be more active, eat better, sleep better, and manage stress better. The fifth one is take your medications, and the sixth one is quit smoking. There aren't that many behaviors that make a difference. And those behaviors make a difference in a way that's incredibly multiplexed, right? If you just change one of them, it makes a certain benefit. But if you take your medication and you're more active and you eat better, you can reverse many of these conditions. Now, COVID is different, right? But what's the same about COVID is if your starting health status of diabetes or hypertension or other conditions is normalized, or you have a better starting health position, you're much less likely to have severe consequences. So they're all linked together. So I think this paves the way, allowing us to do a lot more monitoring, inspiring people into action so that we can tackle problems earlier and help to get everyone's health in a state that's more likely to lead to overall happier, healthier lives.
Right. And Dr. Radin, what are your thoughts on, where do we go from here?
Yeah, I think, again, these wearable devices really have the ability to improve individualized medicine. So right now, if you go to your healthcare provider and have a resting heart rate anywhere from 60 to 100 beats per minute, which is based on population norms, you're considered normal. But in fact, so I have a resting heart rate around 60, and I've noticed when I've gotten sick, my resting heart rate has gone up to 75, which still falls in that normal range. And kind of being able to identify what's abnormal for you will enable us to identify problems or something going on in your health earlier and better than is currently possible using population averages that are applied to everyone across the board. I think the other great thing about wearables is 1 in 5 Americans now wears one of these wearables devices. So again, there's immense possibilities for tracking or doing early disease detection at the population level. So hopefully when the next outbreak occurs, we'll be able to spot it a lot faster and quicker and hopefully contain it.
I want to add one more point to that also, like people are also doing prognostic monitoring, just even with COVID. Of course, you can do that with all of the other illnesses, as Dr. Moore and Dr. Radin have been saying, but specifically for COVID as well, there are cases of using, for instance, a pulse ox, like a continuous pulse ox, or even Fitbit watch that you can then put on the person, and you can imagine, for instance, a physician might say, hey, you're sick, but not like so sick that we want to admit you to the hospital, and you can go home. But then this person is being continuously monitored. And in one case where someone having the pulse ox being measured, the hospital then, the triage system called them to say, hey, actually your oxygen levels are dangerously low. You should come back to the hospital. We want you back in the ER. And that person's life was actually saved because of this wearables monitoring. So you could even just an immediate use would be just starting to do prognostic monitoring of people that are sick with COVID. And to reduce burden on hospitals, you can send people home, but then bring them back when they're likely to get worse.
Right, okay. And then obviously, there's been advances made in research using wearables, but what are some of the ongoing challenges and barriers to using wearables technology and data in medical research? Dr. Radin, can you give us your thoughts first?
Yeah, I think the biggest challenge is engaging participants. So we really want to create something that people want to go to our research app and kind of learn about what their data means and what their individual norm is, and something that provides useful information back to them. So we're providing a value. And I think often with wearable devices, people wear them and then stop wearing them pretty quickly after they kind of learn what their average baseline is. So I think the hardest part is providing kind of continually adding added value to the project and the wearable device.
Dr. Mishra, your thoughts?
Totally second what Dr. Radin said. We had participants that just stopped wearing the device right around the time they got sick with COVID. And so you can imagine, people getting sick, they're like, oh, I don't want to wear this watch. I'm just going to put it away. And so then we don't have data around the symptoms, and we can't really train our algorithms. So definitely one of the challenges was having, people not wearing the devices frequently. The other kind of, I think, thing we do need to think about is validating these as actually medical devices. That's another kind of potential thing. And the ability to distinguish between COVID-19 versus other illnesses. Are we actually able to do that? And what are the signals that we're giving people? How often are we alarming them? And thinking about whether we're just creating fear, or whether it's just whether it's really something, a signal that they really is indicating some health issue that they need to respond. Like achieving the balance between how often are you telling someone you're about to get sick versus catching, doing often enough that you actually do catch them when it's important and they are getting sick. I think those things are things we still need to figure out that are still being ongoing.
Okay. And Dr. Moore, what are some of the challenges and barriers that Fitbit is seeing with its research?
I think the research barriers were covered pretty well. I think when you productize something, you can create an experience that's really engaging. People want to stick with, they want to wear the watch all the time. But when you're doing research, it's tricky, right? Because you don't want to perturb the system too much. You want to observe more. But when you're observing, you're not providing as much of an engaging experience. In our research around COVID, we didn't really experience that because ours was retrospective. But as we look towards prospective research, it's a little trickier, right? Because you need to find that balance. But otherwise, the points about challenges of research were well covered. I think the other set of challenges to talk about is the challenges of how do you incorporate wearables into actual clinical care, which is the next step here, right? We're finding great research outcomes across infectious disease, across chronic disease, in monitoring and in behavior change. And we want to get this out there to as many people as possible. And that means helping to engage with people as doctors and nurse practitioners and nurses and other providers. And the trick is it's tough because workflows for clinicians are very short. There's a lot of data that comes off of wearables. So I think the trick is going to be, how do we synthesize this data in really actionable and concrete blocks of insight that is actionable, that allows users to share it with their clinicians in really seamless ways, that doesn't overburden the clinicians with too much to interpret, because they have busy days with a lot of work to do. So we need to distill it down really tightly. And we also need to fit it into their business models, right? As healthcare shifts from fee-for-service to value-based care, we need to figure out how wearables and how these kind of capabilities fit into that new rubric of how healthcare is managed and paid for. So a lot of tricky things there, but in the end, if it's helping to detect disease earlier, if it's helping people to take action to improve their health behaviors and improve their adherence, then I think we're all going to be on the same team trying to figure out how to combine it all together.
Right, yeah, great points. And this will be my last question before we start taking some questions from the audience. But privacy is obviously a big concern with consumers. So how do your organizations handle data privacy when you're collecting this data? And for employers who want to use wearable data as part of their reopening strategies, how do they ensure that they're keeping their employees, health data private and secure? Dr. Radin, do you want to take that first?
Sure. So we're, again, a research study. So our everything we do goes through our internal review board, which makes sure that data security is upheld, and we have an informed consent where people go through and learn about our study before they agree to participate. We also, people who enroll in our study can share as much or as little data as they want through our research app. So if they're not interested in, say, sharing their electronic health records, they don't have to. So we really give all the options to the participant. And I think that's really important.
And Dr. Mishra, can you kind of tackle the issue of data privacy and also your thoughts on how employers can ensure that the data is kept private?
Yeah, so we, again, as Dr. Aiden said, we're also a research study. And so we developed this, can you hear me actually? It says my internet connection is unstable. Okay.
I can hear you.
Okay. So we developed this study app to collect the participants' data in a very, very secure manner, and we really take data privacy very seriously. On the Stanford Privacy Office, actually, they really liked the steps that our software team took to design the app, to the point that they want to give them a privacy award. They want to nominate them. Yeah, so we store everything in sort of secure systems, obviously, and as Dr. Aiden pointed out, the research is approved by the institutional review boards, and one of the things we really care about is informed consent. So informing the participants of where your data goes, and I'm sure Scripps has had to deal with this also as being a research institution, as does Fitbit. Being very clear and open to the participants about what we're going to do with your data, and where it's going to go, who's going to see it, and only having obviously approved people on our research protocols. And this is very typical for any research institution where you're doing human subject research, is to disclose to the participants, but also only share the information with people who are approved to be part of the study team. And then in terms of thinking about what employers do with the data, so that's something to think about in terms of, so employers are already doing swab testing for their employees and presumably have access to those results. If we, for instance, if we are working with someone, let's say we're setting up a study where they have watches and we're trying to use them to try to predict COVID-19 in their participants, I think it would have to be set up in the same way. And even just if employers were using this in their own institutions, just using smartwatches to get this data, privacy is a huge concern. And I think as an employee, you would be very valid and legitimate. You would have concerns about sort of, what does my employer know about my health? What are they learning about my heart rate? And so you would potentially imagine setting up a system where perhaps your employer finds out if you have a red alert or warning where you really need to isolate, but then creating systems and setting up systems where the employer doesn't have access to the rest of your data, because as you can imagine, having your heart rate, your steps, or your sleep, those are it's almost like your genome. Those are very intimate things about you, like when you're, your sleep cycle, or when you're waking up, or so you don't want your employer potentially having access to that, but you do want some system where you are able to isolate, and if it's in your employer's interest that you should isolate, then the employer also has access to, well, this employee shouldn't be coming into office or whatever, so maybe their badge doesn't work for that period as long as the alarm is happening. But yeah, this is absolutely something important to think about.
Right, great points. And Dr. Moore, what are your thoughts on this issue of privacy and how employers can safely introduce this technology to their populations?
Yeah, so I completely agree with the points that were made about the research. It's a relatively constrained problem. You use an IRB, you have really clear consent, you take great care with the data. A lot of work to be done and extremely important, but relatively contained. In the employer space, the things that we do on top of that, so we in addition with anything sensitive like this, for example, we have what's called a Ready for Work product. And part of that is helping people stay active and deal with emotional health, et cetera. But we also have a daily check-in experience that shows people their breathing rate, their heart rate variability to give some of these early cues. We also do sampling of symptoms, temperature, exposure. And what we do with employers and employees to protect privacy is we make the employer agree to a pledge with us, and we only work with them if they allow only a very small set of people to have access to very high level data that comes out of the system that is actionable. So to Dr. Mishra's point, they don't get access to all the granular data. They don't even get access to what the person's temperature was or what symptoms they had, but they get access to the fact that this person screened positive that they need to self-isolate, or this person screened negative. And it only goes to the most focused group of people within that company who are taking action only to serve the health of the community. So some of it is managed by data reduction so that we're not giving away granular details. And some of it is a pledge that the employer has to take about how they're going to use that data. And it's the combination of those that limits the risk for the employees and maximizes the value for everyone.
Great, okay. We've got a lot of great questions in from the audience. So this one question is really interesting, kind of talking about like next steps, as you're mentioning, you know, integrating some of this into healthcare and the clinical workflow. Let's say after a wearable-based nudge is generated, how do you envision the next steps to be in terms of the patient journey? Does like a red level threat result in a nudge to schedule a telehealth appointment? Do you get a nudge to go get a diagnostic test? Do any of you have any kind of thoughts on, you know, what the next steps would be in a patient's journey?
Go ahead, John. Well, we would nudge the person, at least as far as our COVID management goes, for sure to get a swab test. And we've tried to figure out how often we are asking people to do that. And we've been able to get it down to just a few times a year. So we think that like 3 times or at max 4 times a year. So we think that that's not too unreasonable to ask people to get swab tested a few times a year.
Yeah, and speaking a little more generally, I think the way this is going to head with wearables in general, not just with COVID, is giving people options. And the 2 big options are to really have their data exported in a really concise format that allows them to either digitally or physically share it with their own providers so that it can form their interactions. And we want to nudge them along the way about the importance of these findings without being a nuisance, right? It's tricky, right? Because none of these technologies are going to be 100% accurate. You're going to have some false positives. You're going to have some false negatives. And regulators will help us to make sure that we choose an operating point there has reached a level that provides more benefit than risk to the population. But from there, we want to nudge people into action because our natural response psychologically is to say, getting healthcare is tough. And you know, sometimes we have lots of other things going on in our life that might take precedence. So we make it easier. We reduce the friction and we give people that export that allows them to take it to their providers. But we have a trend going on that lots of people don't have a primary care provider, unfortunately. And we want to help drive more and more people to have primary care. But those that don't, maybe we can connect them with virtual primary care and give them the option that if the easier thing for them is to get on a telehealth visit with all of that data summarized, then they have that choice as well, right? So for whatever person's journey of the right path to access to care, we meet them there. And hopefully, as many times as possible, by giving them that choice, we're avoiding the other choice, which is to go directly to urgent care or ER if that's not warranted. Right? We always want to have a fallback that if things are really serious, well, go to the ER or go to urgent care. But many times with this data, we're detecting things upstream. So we want to give people options that allow them to connect into care at the primary care level.
Great, okay.
Yeah, I totally agree with everything that's been said already. I think in the very near future, there's going to be home diagnostic tests, much like a pregnancy test. So if we see some sort of elevation or change compared to individuals normal, they can very easily take this test at home before going anywhere. I think also there's great potential with these wearables to look at kind of disease severity projection. So whether you need to go to, say, primary care or the emergency room, kind of where your severity lies, I think there's potential to kind of better understand someone's trajectory and intervene at the right level.
Okay. There's a couple questions here about sleep tracking and the potential to use sleep tracking data to study disease and detect illness. Do any of you have thoughts on the value of sleep tracking data?
Yeah, it's huge. All of us are using sleep data in some way in this COVID detection scenario. In fact, at Fitbit, we're detecting heart rate, breathing rate, and heart rate variability, all while people are asleep at different phases of sleep, so that we normalize a lot of things that happen during the day, right? Your activity, your alcohol consumption, or other things that are going on in your daily life while you're not sleeping are much more variable. But while you're asleep, there's a lot more homogeneity. So there's really a lot of information that can be gleaned there. And it's not just for infectious disease. Tons of information about how your body works can be gleaned while you're asleep.
Any other thoughts that you, Dr. Baden or Dr. Mishra, that you'd like to share?
I would say, just like resting heart rate, wearables have the ability to better quantify what someone's normal sleep is. Before wearables, we relied on self-recall, which is actually pretty unreliable and inaccurate. So this is a way to kind of better understand, again, each person's individual norm.
Well, unfortunately,
Yeah,
go ahead.
Oh, go ahead. No, depression, diabetes, there's no end to the number of, I think, there's a number of chronic illnesses that you can track with sleep. So it's going to revolutionize, I think, how we track these illnesses, but yeah.
Okay. Great. Well, unfortunately, we had a lot of great questions from the audience, but we have run out of time. So I would like to give a big thanks to our panelists for sharing their really terrific insights and having this really great discussion about the current state and the future of wearables to detect illness. And thanks for joining us for this virtual event. And now I'm going to kick it back to Health for the post-session event.
Thanks, everyone.
Thank you.
Thank you.
Thank you, Heather, and to all of our panelists. If you'd like to continue the conversation, please join us on Twitter. And now, relax and unwind with a guided meditation session with Daniel for Mindful.
All right. Hello, everybody. So my name is Daniel, and I am a meditation instructor at Mindful. And for the next 12, 15 minutes, we're going to take some time really to give ourselves the space to not do anything, which can be a radical thing in our day when we are jumping from one thing to the next, answering emails, dealing with distractions at home, and how often do we give ourselves permission to just simply rest? And there's so much scientific benefit that comes from when we actually stop and quiet our nervous system, and it enhances everything from focus to sleep to our mood. And when we're in our thinking minds for the most of our day, we kind of lose connection to the other parts of our body, the parts that tell us information throughout the day. And if we're up in our thinking minds for too long, we can start to feel anxious, and all the different, unsettling, uncomfortable moods that we can feel. So what we're going to be practicing today is a very simple introductory 10-minute practice for really connecting in with our breath and in our bodies, so that we can bring our state of energy, our nervous systems down to a more relaxed state. And so if you've never meditated before, don't worry. Just a quick point that I want to mention is that you don't have to get rid of any thoughts in this practice. The point of meditation is to not have a completely clear mind, but instead to really notice, become the observer. Really notice how you're feeling, notice the thoughts that arise, and then gently bring it back to your breath. And I'll be guiding you the whole way through, so no need to worry about remembering the instructions or anything along those lines. And so as we come into our practice today, really finding a seat where you feel comfortable, where you feel supported. And if you're sitting in a chair, just feeling the support behind you. And if you need to adjust slightly, inviting your body to really just move in the way that feels comfortable, that feels right. And as we find our posture, taking a nice upright position as the spine reaches up towards the sky, inviting the forehead to tilt just slightly downwards and the chin just slightly in, which allows for the neck to be in alignment with the spine. You can invite the eyes to begin to close or just having them gently open. And in both cases, we're inviting the eyes to begin to relax, to let go of anything that they've been focusing on. Like, this is a time for us to just let go. And then we can place our hands in our lap or on our thighs, inviting that sense of openness in the chest and the heart. And then resting the feet on the ground or wherever you are sitting or laying, just feeling that support underneath you, that groundedness from the earth. And we'll take a few moments just to check in briefly with how we're feeling, especially after this conference. How are we feeling physically in our bodies? Noticing if there's any tightness or initial tension that we might be holding, maybe in the shoulders or the face, the belly. You can gently bring the awareness to each of these parts and just notice, without trying to get rid of anything, just noticing what's there. Noticing how you're feeling mentally today. Has the mind been racing, or is there something that's been really present on the mind? Maybe it's more relaxed and at ease. Noticing how you're feeling emotionally. You know, with everything that is going on in the world right now, on a global scale down to individually, we're feeling so much in these days. So just taking a moment to honor whatever's there. Giving ourselves permission to really just name that experience of what we're feeling. And so as we transition into our practice, I'll invite you to begin to connect in with your breath. And what that's going to look like is beginning by taking an inhale, an extended inhale of about 5 or 6 seconds in through the nose. So beginning. And as you come to the top at 5 or 6 seconds, releasing the exhale to the same count for about 5 or 6 seconds. So really extending the pace of your breath. Noticing how when you breathe in, the belly begins to rise, the chest rises, the body fills with air and energy. And as you release the breath outwards, basically it's a sense of letting go. It's an opportunity to let go of any tension or tightness in the body or in the mind. And continuing with this pace of deeper, fuller breaths. Becoming aware of that in-breath. And then the out-breath. And scientifically, when it's been shown that when we slow down our breathing, we're signaling to our nervous systems and to our minds that We're in a safe place. We don't need to be in a fight or flight mode. Rather that we're giving ourselves permission to begin to relax. It's this tool that we have with us at all times. And so continuing with the breath. Breathing in, know that you are breathing in. Breathing out, simply know that you're breathing out. And also letting go of any expectations of what this meditation should look like, of how the mind should be, of how it should feel like. Really just stepping into this moment, this experience. If you find that the mind is traveling into the past or the future, thinking about what you need to do after this meditation, the invitation here is to just simply notice that you're thinking, to not get down on ourselves, to not get really tight, but to really open up to the fact like, okay, I'm thinking, I'm going to come back to my breath. If that happens for 100 times in the next few minutes, that's okay. Each time that we catch ourselves distracted, we just bring ourselves back home. And so as we continue to breathe, inviting the eyes to become a bit heavier, the tongue is allowed to rest in the bottom part of the mouth. Unclenching the jaw. And as you take your next in-breath, really feeling any tightness in the face, and in the out-breath, just allowing it to melt down the body and out into the earth. Inviting the shoulders to fall away from the head. Tracing down the arms and into the hands, feeling the hands resting on the body. Feeling all the fingers, the tingling and the energy in the hands. Tracing up to our chest. Beginning to notice how the chest rises with each inhale and falls with each exhale. As we move down to our bellies, inviting in a softness into our belly. Noticing how the belly gently expands and deflates like a balloon. Moving down to our seat, connecting back in with the support of what we're sitting on. As we make our way down to our legs, and feeling the entire length of our legs as we bring into our awareness the knees, the shins, the calves. Moving down to our feet and feeling the feet resting on the ground. Noticing the toes on each foot. And any excess tension is melting out of the feet and into the earth. As the body becomes a bit more still, Seeing if you can take in the entire body with this next breath. Noticing how when you breathe in, the entire body expands and deflates. This advanced system that is working on our behalf at all times to keep us healthy, allowing us to do the things that we want. And taking a moment to extend some gratitude to our bodies for all that they do for us. Taking in the sounds that are around you, the smells. And in this field of awareness that you've generated, just existing here for a few moments, the state of stillness that is innate to who we are as humans. Breathing in energy and breathing out. As we come to the end of our practice today, you're just taking a moment to check back in with how you're feeling physically. Noticing if anything shifted in the body, what it's like to become present there for 10, 15 minutes. Noticing how you're feeling mentally and emotionally, and just checking in. As we come to the end of our practice, we'll take one more deep breath in through our nose, and then breathing out. And as you come back into your room, we'll begin to wiggle the fingers and the toes, moving the neck and the back, inviting it to stretch and move in whatever way feels right to you. Really taking your time and coming out of this practice and gently opening the eyes when you feel ready, allowing the colors to really soak into the eyes. And when you're ready, without rushing, fully coming back into the room and coming back. And I'd like to extend gratitude to everybody who participated in this meditation, really showing up and taking some time and space for yourself is one of the deepest forms of self-care. During these times, we can forget because we're doing, going, getting things done, that even just pausing is one of the greatest acts that we can do for ourselves. So even if it's for a minute, 10 minutes, finding time to do that throughout the day, and that allows us to show up more fully for the people in our lives, for our jobs, whatever that may be. So from Brooklyn, I want to say thank you. And I will pass it back to the health team. And I hope you have a wonderful rest of your day. Thank you.
Thank you, Daniel, and thank you everyone for joining us. Have a great rest of your day.